Welcome to Mental Health and You. This podcast brings you the best information and advice from across the Norfolk and Suffolk Foundation Trust. Every fortnight we will hear from one of our specialist areas, be it school and parent support, the Recovery College, wellbeing or research.
Hello and welcome to the NSFT Mental Health and You podcast. My name is Dr. Lauren Granger. I'm a clinical psychologist and I'm thrilled to be hosting the podcast today from NSFT's Staff Support Service. And I'm really lucky to be joined today by two of our fabulous service users, Natasha and Kerry. Hello both.
Hello.
Hello.
Hello. So in today's episode, we're going to be thinking a bit about looking after your mental health at work. And I'm going to be talking a little bit about what the Staff Support Service does and chatting to Natasha and Kerry about their experiences of seeking support for when they were struggling with their mental health. So first of all, I wonder if it would be helpful for me to tell you a little bit about the Staff Support Service and what we do. So our service was set up as a result of the COVID-19 pandemic, and we run in partnership with Minds to provide support for health and social care staff across Norfolk and Suffolk. So our service is open to all health and social care staff who feel like they might need a listening ear, maybe a bit of signposting to other services or resources that might be helpful for them. And we also have a therapy team who are offering a really wide range of psychological therapies. And I think the key thing about our service is that we really understand how hard it is to be a frontline worker. We're all frontline workers ourselves, we're all healthcare workers, and we know how difficult that is to switch from being somebody that looks after everybody else to seeking some support for themselves. But we're here to help, we're here to support you, so do reach out and get in touch if you're struggling. And at the end of the podcast, I'll make sure I share our contact details. So if you're listening to this and you feel like you might need a bit of a chat or a bit of support, you can contact us if you need to. So I'm going to just pause there and turn to introduce Kerry and Natasha, who are our service users joining us. So thank you so much, both of you, for being here. You're both healthcare workers, aren't you? So Kerry, I understand that you're a practitioner in a hospital, and Natasha, you work in a GP surgery. So gosh, it's been a tough couple of years to be a health and social care worker, hasn't it? Well, it's been a tough few years to be a person, but particularly working in frontline services, it's been really difficult. And I wonder if you could just tell us a little bit about your experiences of recognizing that things were feeling really difficult and thinking about how you might want to access some support. What was that like for both of you?
To be perfectly honest, Lauren, I didn't recognise that I needed any support. And although I've seen posters, displayed at work, sort of promoting the services, and I was aware of it, talking to other members of staff, I hadn't actually had an opportunity to use it myself until I had a car accident. I think when I had the car accident, after working some extremely long hours, probably like so many other frontline healthcare workers, I think that was when the penny finally dropped. And although I think even work colleagues and family and friends had recognised that I was exhausted, overwhelmed, and got myself into a really quite sorrowful state, did I really think actually if something had really badly happened from that car accident, my life, my children's life, my husband's life would have been very different. And I think that was the wake-up call that I needed to reach out and speak to someone about actually what I was going through. So it was an absolute lifeline for me to recognise how hard and difficult things had become. And I think because we're in the healthcare profession, I feel to some extent we're almost, the ownership is on us to suck it up and get on with it. And that actually we are not meant to fall down. We are meant to stay strong and support all our patients and care users. And actually we are not meant to get ill in any shape or form. But in reality, we are all human beings and we all struggle with different things. So having that service there to sort of give you the support you need, have someone to listen to what I was going through, to recognise and actually fundamentally make me feel that who I was and who I had lost through this pandemic was quite an eye-opener. So I was very fortunate. I had a fantastic supporter with Leona, who is my link worker. She was phenomenal, and the support, was second to none. And I think if I'd gone for my own doctor's surgery, I probably would have been waiting probably several weeks, to be fair, because we know what the resource is like in mental health as it is. So having someone there who at any point, even when she was off, she said, if you need support, you ring, here's another number, there'll be someone to support you no matter what. Even when she was going away for a month, she was touching base with me. You know that actually you had an ally, and I felt that's what I had. It wasn't just someone who I could speak to about my issues, it was someone who I could generally talk to, who could give me advice, who cared, who followed me up and still continues to follow me up even 6 months later, just to check that I haven't slipped back, that I have got the right mechanisms in place. And to be perfectly honest, it's been a phenomenal service and I can't be more grateful.
Oh, thank you. It's so powerful there to hear that journey of right from the beginning, and I think this is probably something which lots of people will echo and understand, is often it takes either something at a real big event to make you think actually maybe I'm not okay, or also it takes other people might notice before you, and it takes them to say actually I really think you might need a bit of support. And that often we hear lots of people working in frontline services throwing themselves into helping other people and find it quite difficult to kind of reflect on their own struggles, which was really powerful to hear about. Thank you for kind of sharing your kind of journey through. Kerry, what about you? What would you tell us a little bit about your kind of journey into the service, how things were for you during that pandemic and how you got to need some support?
Okay, so my situation, I suppose, is slightly different from Natasha's. I was frontline worker in a hospital. Obviously, overnight we changed. We became, everybody had a role change. The camaraderie between our colleagues while we adjusted to the new way of working, if you like. You were put in places you'd never worked before. You were expected to cope with situations that you'd never dealt with before. I mean, everybody, obviously it was a pandemic, everybody was dealing with different things. I was coming home and I was supporting. I think this is important as well to say that, you were coming home and you were supporting your family as well. I've got 2 teenage daughters, one of which should have been sitting her GCSEs. Her life changed overnight. The other one was looking forward to going to uni. Her life changed overnight. So it was a whole lot of different situations, I think, that we dealt with that year. I would say I was fairly strong at that time. Sadly for me, the January I caught COVID, and for me that was the tipping point. So I have now got long COVID, and sadly for me 5 weeks ago I caught COVID 2.0. So my life has changed incredibly. I've had to walk away from a job that I love. I'm having to deal with a new me, a different me, with more health issues. I'm having to consider potentially medical retirement at quite a young age. So I think it was probably about week 8 of long COVID. I mean, it wasn't long COVID until I hit 12 weeks, but I knew at week 8 that actually I wasn't improving. Nothing was changing for me. Would I ever get well? Would I ever be? It's all right. This is where I start to get emotional. I'm really sorry.
Don't apologise. You're doing really well.
With things actually, how was this all going to pan out? And certainly, when I was really, really poorly at the very beginning, I mean, don't get me wrong, I wasn't admitted into hospital or anything. I mean, I should have been, but there weren't any beds. but when I was sitting there one night, and I'd just come back and they thought I had blood clots, and I was sitting watching the telly looking at how many people had died, and I'm thinking, am I going to be one of those numbers? I think that's when the realization starts to hit that I've put my life on the line for patients. All right, I don't know whether or not I got COVID from work or I didn't get COVID from work. I'm obviously I have no idea. But, we all put our lives on the line for our patients. We all went in. I mean, I had a bag packed in the back of my car thinking if I don't get home or staff don't get in, I can stay at work. That's how we were all working at the time. I mean, it's nuts to think. So it was nuts to think how we were working and how we were running, and then to suddenly become ill from it and having to live a changed you because of it just seems so wrong. And yeah, I was just really, really struggling with dealing with that, with how I was going to be, how I was going to cope. Could I go back to work? All these uncertainties are suddenly been thrown on me because of what had happened. So that's when I started, reaching out for help. As I've sort of like thought about many times, as healthcare people, we are very, very good at looking after others. And as I say, it's not just people at work, it's your family, because you're the one in the healthcare. So people come to you because you're in healthcare, and they ask you questions, and you're supporting this huge amount of people when in actual fact you're the one really struggling. And we're expected to cope and we're expected to deal with it, but actually sometimes you just have to say, do you know what, I can't do this anymore. And I think it was the realization of the fact that I was crying most of the time, and that's not normal. And so that's when I started to think, actually, I need some help. And I actually got the phone number from my occupational health, because they were keeping in touch with me and keeping quite close eyes on me at the time. Sadly, it's not quite the same anymore. And they put me in touch. I mean, I actually went through to Mind, and very similar to Natasha, I was triaged very quickly and put into the service sort of like literally within days. And the support started, and like yourself, Natasha, I've had an awful lot of support, and we chat, and I do treatments, and I don't quite know how I'm going to cope when I have to leave her at the moment. So that's
and the thing is, you've had it really tough, and you're at probably almost the opposite spectrum to me to some extent. And I think, although I was in general practice working 60 to 80 hours every week for weeks on end, coming home feeling like I'm putting my family at risk because I didn't know what I was bringing back with me, going to bed with heart palpitations because I'm tired, I'm overwhelmed, I'm panicking I'm going to make my family. My mum was classed as extremely vulnerable, and having all those risk factors, like you've just said, actually it isn't just work, it was the whole scenario with the pandemic, which is the same for everybody. But as you say, I think as a mum as well, you have that additional pressure. And although I'm very fortunate, I had a partner who was working from home at the time and was in a position that he could do that, which I'm extremely grateful for. It still meant I still had to think of everything else, and actually coming home and having the kids wanting to talk to me, and my husband wanted to relay his day, and actually I just needed 10 minutes peace. And it's awful that actually after a long day I felt dreadful to think I need 10 minutes peace because I just can't think clearly. And I think I came home, and like you said, I got to the point where I was crying every day. Now I'm a very strong person, I've dealt with a lot in my lifetime, but I've got to the point where actually things that I'd normally cope with, no problem at all, I just couldn't cope with, and it just become way too much. And I think it wasn't until my family and friends said, I think you're going to kill yourself, not physically kill myself, but if they thought I was going to have a heart attack or a stroke from the stress I was under and the sheer lack of sleep, that I thought, my God, I'm not that bad, I'm not that bad. And it isn't now, until hindsight's a wonderful thing. You don't necessarily recognise it at the time, but looking back, all the signs were there. And to some extent, I ignored them because being a frontline worker, we think we're invincible. We think we have to carry on and stay strong for everybody else. And like you said, Kerry, we put ourselves last. And to some extent, I kind of understand and appreciate that, because to some extent we do that in our professions. But the problem is, because we've lost sight of ourselves, that's probably the most dangerous thing in a pandemic, is doing that, because actually if we don't look after ourselves, no one else is going to be in a position where they can. So, your ordeal sounds horrific compared to mine, to be perfectly honest. But I know that we've been both very fortunate that we have had the support from the service to help us through what's been a horrendous time for all concerned.
Thank you both. It's just for sharing your stories with us, and thank you, Kerry, for sharing. I can imagine how difficult that was to kind of go through and relive again as well, some of those you know, that real image of you sitting there, you know, worrying about your own health and your family's health, and sitting and watching on television how many people were dying from this virus. That must just have been awful. Imagine, really, you know, so traumatic. And so thank you for sharing that with us. What was it like when you decided, actually, I need to ask for some help? Did that feel like an easy decision to make, or did it feel quite a difficult thing to go, hang on, I need some help from somebody else here? What was that like to do?
Personally, I think it's really, really tough. It's really, really tough to actually admit that you're not coping. As I've already said, you're already aware of the fact that you're looking after everybody else, and you should be able to deal with this. I mean, as I say, I've had many situations in my career where I've dealt with death, and I've literally had to walk back down a corridor and carry on looking after the living. And you don't ever have that debrief, that downtime, that, right, okay, let's just have a moment, let's just have a coffee, let's just process. But actually, you're so busy that you just have to get on and park whatever has happened somewhere. So after many years of doing that and thinking that I guess you're coping with it, you're suddenly not coping with it. And the realization that actually, if I don't do something to help myself here, nobody else is going to help me. And I think it's really, really tough making that decision to actually say, I'm not coping, please, where do I go?
Absolutely.
And I second that. Sorry, I was just going to say, I think I second that. I think for me, I've got a very strong support network in my family, my parents, my husband, my best friends, and actually even some of my close work colleagues. And I think until the car accident, which was obviously my tipping point for me, the signs, as I said earlier, were there, but it's almost admitting defeat. And I think because I know deep down I am a very strong person, I don't ask anyone for help. I'm always probably the first to volunteer to help other people, to actually reach out and acknowledge that I'm the one that needed help. To some extent, I kind of felt it was like a weakness on my part, which I know it's not, but when you're always the strong one, when you're always the one sort of carrying the burden, or so it feels, and probably that's the perception for probably a lot of my friends and family would say that that's just the way that I am. It wasn't an easy thing. I knew it was there, but actually I think having my family listen to me say the same thing over and over again, and the cycle not breaking, I think that's when I suddenly thought, do you know what? I just need to vent. I just need to let off steam to someone who doesn't know me, who can validate what I'm going through. My friends and family can see it, but someone who doesn't know me, if they can say, actually, do you know what? This happened because of this, or this, or they can say to you, you were right, this happened for a reason. What can we do to make it so things are different in the future so you don't make that same mistake again? That was really crucial, because actually I hadn't recognised it, because like I said, everyone's telling me and I almost wasn't listening. I was oblivious to what was going on around me, even though I could still see it happening. So talking to someone totally removed who didn't know me from Adam, to me, was great. I think my only fear was, I was always concerned there was going to be some form of repercussions back at work when you've never had any time off sick and you've been there for donkey's years. And I knew there was going to be some massive ramifications for me being off of the job role that I do, and the knock-on effect it was going to have. Reaching out to someone, I generally thought I'm just going to have a couple of days off. I never envisaged that I'd have 7 weeks. Never, ever. I'd have put my house on it. That wouldn't have been the case. But actually, I really needed that time. I felt guilty the whole way through, don't get me wrong, because I'm conscious of the knock-on effect to everybody else. But for me to be able to get back into the position where I could go back to work and actually taking that step, what was really interesting is that when I did get back to work, the partners came up to me and thanked me for coming back to work, because they thought that was it. They didn't think I was coming back. And when you think, Luminell, that's really, they I think even they were just realised how much things had spiralled out of control for me. So I don't think it's an easy thing to reach out and get help if you're not that way inclined, but the help is there. And I would definitely say to people, if you don't feel you've got a support network at home or at work, or even if you do have them, there's other professionals who are there who are willing to listen, to give you advice, to give you that guidance and stability that you need to help you get your life back on track when you don't even realise how far down that road you've gone. You can make a U-turn and you can turn things around and get your life back on track just with the support from them. So please give it a go.
Thank you both. Yeah, I think it's so interesting, isn't it, that we you know, we find it so difficult often to practice what we preach, and we know we advocate to our own patients and our service users to seek help when they need it, to not be afraid to ask for support, for care, for anything, yet to turn that on ourselves just feels really, really hard to do, when actually we know that we can't pour from an empty cup. We can't keep giving and giving and giving and not kind of nourish ourselves and look after ourselves. And it's really interesting. I think that's something we hear a lot from frontline workers about how it's really hard sometimes to practice what we preach, but we know actually that it's the right thing to do. That's what we all need. And I just want to pick up on what you said, Natasha, as well, around just because we've asking for help from somebody else doesn't mean that we don't have a really good support network of our own, but often it does take an outside pair of eyes. It takes somebody who isn't in it with us all the time to just have a look and go, okay, let's think about this together, let's have a fresh look at it, let's explore, and they might have other ideas and other options and other suggestions, which can just feel like a breath of fresh air sometimes. So why not get someone else
to jump in? Sorry, Lauren, can I just jump in? Because actually, one of the things that my support has, bless her, has been doing is actually making me look at myself and say, do you know what? Because I mean, I actually started on a degree pathway the day I tested positive with COVID. And the whole time I've been poorly, I've been doing a degree. So, you know, she actually says to me, you're amazing. She said, you know, and she looks at what I've done and actually makes me feel proud of what I've achieved. Whereas again, I think that's something we're really, really bad at doing. We're not good at saying, blooming heck, I've done that well at work today. We're more likely to come home and go, oh, I forgot to, I don't know, put the rubbish bins out, or oh, blast, I didn't clean that. Or we're really, really bad at coming home and going, that was a good day. And I think that's where we need to stop and just turn our thoughts around a little bit and come home with that little bit of, you know, come home with the positive and not come home with the negative. And I think we're all very, very bad at doing that. So sorry, I jumped in.
No, absolutely. It's really good to hear that. And I think that's a really good point. It is sometimes we need somebody else's eyes to look at things and go, let's have a look at where you're struggling and let's look at the bits that are feeling difficult, but let's also look at what you're doing really well, and let's look at things that are going really well for you and how can we nurture that part. And that's so important. We need that, because as you say, sometimes it's hard to do that for yourself, and often when people, you know, people that are close to us, it's hard for them as well sometimes to be able to do that. So to have that other perspective is really, really important. So yeah, I completely agree. Okay, so thinking now a little bit about when you were accessing support, and it sounds like you both were allocated your own therapist, your own support from our team. What was it, do you think? Tell us about that journey through getting that support, and what was helpful? Was there anything that you learned, or anything that felt like actually that was a really useful thing?
I think making that initial call, I have to say, I wouldn't necessarily say I suffer with anxiety, but I think my emotions were absolutely bubbling over and in abundance. So by the time I done that initial call, the person taking the call, doing the triage, I think obviously they were quite concerned because I probably couldn't get my sentences out properly. I was just too emotional. So they helped me breathe clearly so I could relay what I needed to say. And that was just on the very first call, because I think at that point, you want to just kind of get it all out and done with, and if someone say, okay, you're better now, and then it's kind of done. And in my head, I was kind of thinking, that's all that's going to happen. It's just going to be that someone will talk to me, they'll say you're fine, and off I go. And they were so good. They took as much time as I needed. They didn't rush me. They asked if I had someone present with me, if I needed someone, or if I wanted them to call me back just while I collect myself. And they said, they literally explained the whole process. This is what's going to happen next. You're going to get a phone call tomorrow. They're going to go through this system with you. You can tell them as much or as little as you like. It's confidential. I mean, they really showed, one, from every aspect that I had with doing, they showed they cared. I wasn't just a number. I was a person. They made me feel that way. And for everyone that I spoke to, even when I struggled a couple of days in, and I thought, because I'd had a call from work and it had literally tilted me over the edge, and I thought, I don't know what to do, because I wasn't speaking to the following week. I rung them up and they were phenomenal. They really were. They were just like, this is what you need to do. This is how you're going to do it. I'm going to put you through to so-and-so, and they're going to go through what your next steps are. Someone was still able to step in and say, right, that's fine, this is what you're going to do. And actually, it's just that continued support and advice, not just the fact that it's not present, you'll have to wait, which so often, in probably, especially in general practice, I'm sorry, this clinician's not in for another 2 weeks, you'll have to wait if you want to see that person. There was someone else who could step in. And fundamentally, that's that continued stability that I needed. So the access was brilliant. I really can't fault the service. So I'm hoping Kerry probably found something similar.
Yeah, absolutely. From the minute I rang up to, again, like Natasha, I was triaged. I don't think I was called back quite so quick. I think I was called back sort of like a couple of days later. And then I was put in touch. Well, I had a couple of conversations with one lady, and then it was decided that I needed to sort of like go down a slightly different route. And yeah, and then I met Lee, and my life has never quite been the same again. She's she's really made me be able to stop and try and move forward, because I suppose, you know, in my situation, it's like a loss. You know, I'm grieving. I'm grieving for the me that I had. I'm grieving for the job that I had. I'm trying to come to terms with what's happened. So a lot has gone on, really, and that support that I've had from you all has been incredible. She did actually say that she thought I was coming to the end of my treatment, and then I caught COVID again, so I think I've got a few more weeks with her, which is brilliant. Yay. But it's just having that listening ear and being able to offload stuff that you don't want to offload with your nearest and dearest sometimes. With, you know, they're worried enough about you. You know, certainly, as you said, Natasha, you know, I've got an amazing supporting family, but you don't always want to offload onto them. And certainly, you know, there's been days where I haven't wanted them to know how scared I am. So to actually have that listening ear and somebody outside of your safety zone, I guess, is brilliant. And again, as I said earlier, that, you know, to look at the positives as well as the negatives, to help you come to terms with what you've lost and to help you move forward. I mean, as I say, I would sit there and I would have half an hour, 40 minutes, an hour, and all I'd do was cry. And it got to the stage where she turned around and said, do you realise we've been on half an hour and you haven't started crying yet? And I'm like, yay, I'm getting better. So it's having that, that support is just it's just needed. It's so needed, and it's just, as I say, I couldn't have done it without you.
And it's deserved as well, because when you think you put so much into your job, to your patient care, to have something like that in return is amazing. I mean, I was just going to say, for my link worker, because it was linking into work, I was fortunate to the fact that she was a team manager, so she knew how I needed to go about things when I was being contacted from HR, and, you know, gave me advice on that as well, which I never would have expected. I thought she was there literally just to support me with my frame of mind. So to have someone give me guidance on that was totally invaluable as far as I'm concerned, because she really made it easier, because otherwise it was someone else I would have had to have spoken to about, I don't know how to go, where do I go with this, what do I need to do. So yeah, I was very fortunate as well. And, you know, I can see and listen to Kerry and how awful the ordeal was for her, and I'm very thankful the service was there for both of us to see that things can come out positive as a result of it. And although we're probably still on our journey, for both of us, I would say, we've definitely made big steps into the right direction.
It's great. That's so good to hear, and thank you both for sharing, and so good to hear the different types of support that you've received and how that can be useful. And as you say, Natasha, so well deserved. We all need this. You know, it shouldn't be a real privilege to have, and I'm glad that you've been able to access a bit of support and when you needed it. That's really good to hear. Okay, so I mean, it's clear that even though we've passed that kind of real height of that pandemic, many of us are still bearing the emotional and the physical scars from that period of time. And working in health and social care is often very difficult at the best of times. It's not an easy job to do. What would you both say to frontline workers who are just feeling at the moment like they're struggling a little bit with their mental health? What advice would you give? What tips? What would you say to those people who might be listening?
I think number one is recognising that you're not coping. If you look at what you've dealt with, it's actually okay to turn around and say, do you know what, I'm not okay. I've seen a lot of members of staff, certainly within within a hospital setting, that have dealt with, and they have seen things that we've never seen in our careers. And as long as as I say, we're all very, very good at saying, yeah, I can cope, yeah, I'm fine. But actually look at yourself and say, do I need help and support? I mean, I'm very much an advocate of the service, as is Natasha, and I think we both go around and I certainly tell people about the service. I do have the phone, or I do give the phone number out, and it's a matter of almost not being embarrassed to admit that you're struggling, and to accept the fact that you need help, because as I've said time and time again, we feel that we need to be the strong ones. We're the ones people come to. We're the ones that are dealing with everything, elderly parents, teenage children, young children, husbands that potentially, during COVID weren't making a living. There's lots of things that have been going on in people's lives, and actually to be able to get help, it's essential. So people weren't coping, I'd just say, right, you will get help if you ring this number, and you will get help really, really quickly. So that's all you can ask for.
And I think I would second that. I think acknowledging, actually, do you know what? We've all had a hell of a ride. And I'm not talking about just healthcare workers. It's been lots of professions who have had it so difficult during this pandemic. So I'm not obviously diminishing anything that anyone else has done. But those frontline workers who have put their heart and souls and lives and health on the line to help and support the health of carers, patients, and even colleagues, those scarrings are going to be there for a very long time. And I think recognising, actually, you're still standing and you've still done an amazing job. Regardless of the fact that you're still standing, you've probably got scars there that you probably need to deal with at some point. And I think, don't wait till you get to the point like myself, where I've had to wait until I had a car accident to really recognise that how overwhelmed and exhausted I was. I wish I'd used the service sooner, probably when I hadn't spiralled out of control so much. But recognising it's probably one of the hardest things. So if you have got friends or family or colleagues who are having these conversations with you, do listen. The service is there. There are people who care. They want to help you get on the right path. So it's fundamentally important that actually you look after yourself first, because actually without you, patient care can't go anywhere. So as Kerry said, I'm absolutely advocate for this service. Please look after yourself and take the opportunity to speak to these people who will be able to help.
Thank you so much, both of you. It's so powerful to hear that from you and to hear your stories, and it's so brave of you to come on here and be prepared to share things that have been really, really difficult, and we appreciate it and so grateful for you sharing your stories with us today. So thank you ever so much. I'm aware that we're coming, sadly, to the end of our podcast episode, but before we finish, I do just want to share the details of our service for anyone out there who might be needing a bit of a bit of support. So health and social care workers across Norfolk and Suffolk are able to self-refer to our service. So we offer a confidential support line, which is open Monday to Friday, 9:30 till 4:30. And that number is 0300 123 1335. Or you can just send us an email at staffsupport@nsft.nhs.uk. Thank you so much. And thank you everyone for listening.
Thank you.
Thank you.
Thanks for listening. Please do subscribe. It's free and means the podcast will automatically download every fortnight. Do rate and review Mental Health and You, and follow our social media accounts. They're all in the show notes. And more than anything, look after yourself.